Going to the next session, what are Wiggers diagram? Okay, Wiggers, what is Wiggers diagram? This is complicated, but it is very easy if you understand. Okay, what is Wiggers diagram? This is Wiggers diagram. We combine all the phases of the cardiac cycle. Okay, we will discuss what will be the aortic changes. Number one, this is a curve I am highlighting. This is the aortic curve. Okay. Number two, what we will also discuss what are the changes in the left ventricular pressure. This is left ventricular pressure curve. Next, we will discuss jugular venous pulsation, JVP. Okay. And we will also discuss the left atrial pressure. Okay. This is the left atrial pressure. This green. ये हो गया 1, 2, 3, and the fourth point we will discuss what are the change in the heart sounds during this cardiac cycle. And number 5, we will discuss the what are the changes in ventricular volume. It was the pressure here, but we will also check what will be the changes in ventricular volume. Okay, this was the fifth. And what are the sixth thing we will discuss is the also right atrial pressure curve, which is called JVP. Okay, so we will discuss last seventh point, that is the ECG changes. So one by one we will discuss it. First of all, you should know that we will study in start from the P wave. Okay, all the people know that P wave is starting when there is a atrial systole. P wave is starting P wave when there is the atrial systole. Okay, what will happen in this stage? When there is a atrial contraction, there will be a wave in JVP. So right atrial pressure, this is JVP. So there will be a wave. So I am pointing the green with all these phases of the atrial contraction. What will happen when there is a atrial contraction on the ventricular volume? Not a much change. Okay. What will be happening in atrial contraction or atrial systole? S4, if there is any pathology. So very important. S4 occur when there is a problem in atrial kick. This is atrial kick. Okay. So whenever any patient like old age, hypertensive, hypertrophic cardiomyopathy, these all are having the atrial kick producing S4 because there is very important point, that is high atrial pressure. Because due to the stiffening, the left atrium has to put more pressure to pump blood from left atrium to the left ventricle. So this produces a pathological S4. That S4 happens in which patients? With a ventricular hypertrophy, and it is associated with left ventricular hypertrophy. Also old age patient, and also the hypertension patients and HOCM, hypertrophic cardiomyopathy. Is that clear? No. The next phase, which is atrial contraction, what will be happening? There will be a wave in the left atrial pressure. Likely, the jugular venous pressure is the right atrial pressure. Okay. So same is the waves in the left atrial pressure, but it's a different name. When we talk about JVP is the right atrial pressure, jugular venous pulsation. Same will be the A wave in the left atrial pressure. What will happen in the left ventricular pressure and aortic pressure? You can see in the diagram, this is aortic pressure and this is the left ventricular pressure. So not so much change, not so much change. So we discussed that in atrial systole, the major change I will highlight. These are the most important changes that occur in the, that is the A wave production in the JVP during the atrial systole, atrial contraction, that is associated with our important pathology, that is atrial fibrillation. Okay, that atrial fibrillation that is absent. This A wave is absent. Okay, so there will be absent of the A wave in atrial, which is due to atrial contraction. This is very important pathology. Next pathology due to production of S4 we discussed in the old age, hypertension and HOC. These are the most important. Next we will discuss the changes. I will highlight this color. What are the changes in isovolumetric contraction? We will discuss now the systole. Okay, isovolumetric contraction. What will be happening? You know that when QRS is ventricular depolarization. We already know QRS is the ventricular depolarization. Okay, so ventricular depolarization produces QRS. So this phase is QRS. QRS. So this all the phase like this is having isovolumetric contraction. What will be happening in this stage? What will be happening? Number one, we will discuss an ECG change. That is the QRS. Next, what will be change in the GVP? No change. What will be the volume of ventricles? In QRS, when ventricles are starting to contract, but I told you already in isovolumetric contraction, volume is same. Like iso means same, volume means volume. So no change. It will be same in ventricular volume. So what will be production of the sounds? I told you important MCQs of FCPS part 1. Many times it is repeated question. S1. Production of S1 in isovolumetric contraction. This is important point. What will be the next in the left atrial pressure? That will produce the important in the JVP, that is the C wave. C wave. This is, but when it is always produced when there is a closed tricuspid valve, mean isovolumetric contraction. Okay. C wave is produced when there is a right ventricular contractions, closed tricuspid valve bulging into the atrium. That C wave in the jugular vein is occurring in this isovolumetric contraction. Next, what will be the change in this isovolumetric contraction? In the left ventricular pressure, this curve, and aortic pressure, this curve. You can see in this isovolumetric contraction, there is no change in aorta. Aorta is like this, no change in aorta. Aorta having no change in pressure, but there is increased pressure of left ventricle. Left ventricle, increased left ventricular pressure, P pressure. So I repeat here, what are the changes in isovolumetric contraction? One by one. First, we will discuss this ECG. It will produce ventricular depolarization starts, produce QRS. And what will be change in this jugular venous pulsation? Number 2 points, that produces C wave. Next, what will be happen in the left ventricular volume? No change. Next, what will be change in the heart sounds? That producing of S1. What will be change? What will be the change in the left ventricular pressure? It will be increasing. Left ventricular pressure will be increasing. What will be the change in aortic pressure? No change. Okay, so we discussed the atrial history, we discussed isovolumetric contractions. Next, we discuss the rapid ejection phase. Okay, I will highlight this rapid ejection phase with a green color. Okay. Now, we are discussing this rapid ejection phase. Rapid ejection phase has not any significant changes in the ECG, but important point is that, very important point, when there is a rapid ejection phase, there is X descent. This is X descent. This is X descent. This is a deflection downward. X descent is a downward deflection in the jugular venous pulsation. Why? Because when there is ejection of the blood toward the aorta, ejection of blood toward pulmonary trunk from the right ventricle, what will happen? The tricuspid valve, which was tense and going into the right atrium, will move into the right ventricle. So the pressure in the right ventricle will be decreased. So it will be a descent, which is called X descent. And X descent is due to downward displacement of closed tricuspid valve during rapid ventricular ejection phase. Okay, we will study pathologies later on. First, you should study the normal. Okay, what will happen in the rapid ejection phase? First, we discuss not a significant change in ECG. Then second, we discuss change X descent in jugular venous pulsation that occurs in the rapid ejection phase. Now, third, very important point. What will happen in ventricular volume in rapid ejection phase? Of course, it is ejection. Blood is going out of left ventricle. So what will happen? It will decrease. Left ventricular volume will be decreased in rapid ejection phase because left ventricle is ejecting blood toward the aorta. Now, next, fourth point, that is, what are change in the heart sounds? No change, not significant. What are the change in the left atrial pressure? Same X descent. What are the change in the left ventricular pressure? This is left ventricular pressure. What will be the change? It will be increasing more also, but the significant change in this rapid ejection is that aortic valve opens before us, just before rapid ejection. That is an important point here. Aortic valve opens just before this rapid ejection point, and also aortic pressure is rising. Also, left ventricular pressure is rising. Here I will discuss one most important concept and MCQs. Okay, the left ventricle put pressure, and It's match the pressure of aortic diastolic pressure. Okay. So the left ventricle has to develop so much pressure that it can open aortic valve. So why the reason isovolumetric contraction is important? Because left ventricle prepare itself so that it increases pressure slowly increases. But at this point, when left ventricular pressure is equal to 80 millimeter of mercury, which is our diastolic blood pressure in our normal body. So when the left ventricle starts increasing the pressure in isovolumetric contraction, but a phase will come just before opening of aortic valve, the left ventricle will have a maximum pressure that is 80 millimeter mercury. So that aortic valve will open, and now aortic valve will open, and this curve will like this. This curve will be this is and this is called coinciding point. When the left ventricle having so much pressure, it opens the aortic valve. That is a most likely 80 millimeter of mercury, which is a diastolic blood pressure of our body. Okay. So we discussed the atrial systole, we discuss isovolumetric contraction, we discuss rapid ejection. Now I will discuss the next point, which is reduced ejection fraction. Reduced ejection fraction. It is also ejection, but it is reduced. What will be the change in reduced? Number one change in ECG, it will make the T wave. It will make the T wave. What will be changes in the jugular venous pulsation? Jugular venous pulsation. What will be the changes? Not changes. Not a significant. It's not important here. But what will be the change? It will be more reduction of left ventricular volume. Okay. In this reduced ejection, there will be more decreased in the left ventricular volume. That is a one significant point. And second was T wave. Next important point in this will be the necrotic notch. Okay. After this reduced ejection, what will happen? Then aortic valve starts closing. Aortic valve starts closing, and then what will happen? This is a phase where aortic valve closes. That is called necrotic notch. Okay. So this was a reduced ejection. Now we discussed all the phases of systole. What we discussed? We discuss atrial systole, we discuss isovolumetric contraction, we discuss rapid ejection, we discuss reduced ejection. Now we will discuss these phases. What are the diastolic phases? Okay. Now I will start with this blue color. What is isovolumetric relaxation? Iso means same, volumetric means volume. It is same volume. So one of the very important, you should know that volume is the same. Volumetric contraction or relaxation, it is relaxation. So you must know that when there is a relaxation, there will always be pressure will be decreasing in the left ventricle because it is relaxation. So you must know that left ventricle will be decreasing its pressure. That is, of course, very important. Now you should know that when there is isovolumetric relaxation, there will be a filling phase. Start in the atrium. There will be a filling phase when there will be start in the filling of the atrium. Right atrial filling will be started. That causes a filling phase. We say filling. Right atrial filling. Remember, this is causing the V wave. Okay. So next, what will be the change? Isovolumetric relaxation. Very important MCQs. It is producing S2 in the heart sounds. Okay. Now next phase is the rapid ventricular filling. What will be occurring in rapid ventricular filling? First, start with ECG, not a significant change. Okay. Now, what will be occurring in this? Right atrial pressure or JVP, it will be a Y descent. Rapid ventricular, it is a Y descent. We will study the pathologies in a few minutes. What are the pathologies of JVP and what are the associated conditions? We will study separately. But understand the basic things. A Y descent will occur in the rapid ventricular filling. Okay, so in rapid ventricular filling, if there is any pathology, the S3 develops in rapid ventricular filling. Remember S3. What is S3? S3 is early diastolic. It is a sounds in early diastole during rapid ventricular filling phase. It is a best heard with left lateral decubitus position. It is important MCQs for all the exams. What are position that the S3 and S4 are heard loudly? What are position that S3 and S4 both are heard loudly? This is left lateral decubitus position. Left lateral decubitus position. Remember this. Left lateral decubitus position. That is very important MCQs. Okay, so S3 produces in the rapid ventricular filling phase. It is associated with increased filling pressure, like any heart that has dilation, like any condition that causes left ventricular dilation that produce S3. Remember my word, left ventricular dilation causes S3. What are the conditions that causes this dilation? Mitral regurgitation, aortic regurgitation, heart failure, thyrotoxicosis. It is more common in dilated ventricle. And S3 is normal in young adults. But what are the important? That is the which age? Less than 30. S3 is normal less than 30. Normal in young athletes. Normal in pregnancy. Okay. So this is very important. Next very important point that is in this curve, which is the very important. What is the valve? You know that it is left ventricular pressure is more decreasing. Okay. So we discussed in rapid ventricular filling phase. In JVP, there was a Y descent. In the heart sounds, if there is any abnormality or young athletes or pregnancy or young adults, if there is a dilation of the left ventricle, there will be S3. And there will be more left ventricular decrease in left ventricular pressure. And very important points here, very, very important points. What will be change in ventricular volume? Because it is a filling phase, it will be going up. It will start to increase in this rapid ventricular filling phase. So it starts to increase. That is very important. Okay. So we discuss rapid ventricular filling. Now we will discuss reduced ventricular filling. Reduced ventricular filling by this color. Reduced ventricular filling. Not a significant change in this section. So we were discussing this point, which is rapid ventricular filling. Rapid ventricular filling in ECG, there is no changes. In JVP, what are the changes? No changes. In the ventricular volume, number third, ventricular volume, there is slightly increase, but there is a static. What will be changes in the left, in the heart sounds? There is no change. What will be the change in the, what will be the change in left ventricular pressure? It's static. Okay, it's static. What will be change in aortic pressure? No change. So there is a not significant changes in reduced ventricular filling. Is that clear? So now we discuss what are the different changes in Vigor diagram. This is, we discuss all this one by one in collaboration with the 7 different phases, like one was this aortic pressure, second was left ventricular pressure, third we discussed the left atrial pressure, fourth we discussed the association with heart sounds, fifth we discussed the ventricular volume, sixth we discussed the JVP, and seventh we discussed the ECG changes. This is called Vigor diagram. Vigor's diagram. Okay, so now we will discuss some pathologies and a quick revision of our sounds and phases. What are the different sounds? S1, S2. We will discuss the MCQs. S1 is produced when there is a mitral and tricuspid valve is closed. S2 is produced when aortic and pulmonary valve is closed. And the FCPS and MDMS part 1 question. We discussed the 2 very important MCQs here. S1 is in the isovolumetric contraction, and S2 occurs in the isovolumetric relaxation. That is the very important MCQs. Next is S3. S3 is produced in the dilated. S3 is dilated left ventricle. Remember this. And that dilation is mitral regurgitation, aortic regurgitation, heart failure, and less than 30-year age of the young adults, athletes, and pregnancy. Okay. S4 is due to atrial kick, that is associated with the hypertension. Okay, that is associated with old age, associated with hypertrophic cardiomyopathy. Okay, so next we will discuss the pathologies that is associated with jugular venous pulsations. Jugular venous pulsations. Okay, JVP. First is A wave. A wave is associated. A is atrial contraction. Atrial contraction. Okay, it is absent in atrial fibrillation. Remember, this is very important MCQs. Very important MCQs for MD, MS, FCPS, NLE, and USMLE. Most repeated question. It is a previous past paper question of FCPS, MD, MS, and NLE. And the next is C wave. C wave is due to right ventricular contraction because when there is a closed tricuspid valve which is bulged into the right atrium. We discuss this C wave here. Okay, in during the isovolumetric contraction. Next is X descent. X descent is downward displacement when there is the ejection phase of when there is a right ventricle is trying to eject the blood. And what will happen? The tricuspid valve will come back in its position, and there will be a decreased flow, decreased volume of the blood, decreased pressure in the right ventricle. That will causes a downward deflection. So, okay. So this is very important pathology associated in X descent. X descent is absent in tricuspid regurgitation and right heart failure. Why? Because their pressure gradient reduced. Okay, X descent pathology is it is reduced or absent in tricuspid regurgitation and right heart failure. Okay, why? Because pressure gradients reduce, because there will be no ejection. When there is no ejection, the same tricuspid valve will not go into normal position. It will be more stretched toward the right atrium. So when it will be more toward the right atrium, it will put more pressure on the right atrium. When it put more pressure on the right atrium, it will not be the descent. It will be like this. It will be no descent. So in the tricuspid regurgitation and the right heart failure, the X descent is absent or reduced. Next very important point, that is willing phase, filling phase, willing phase, filling phase, filling and willing. Remember, V is always willing and filling, willing and filling, willing and filling. Okay, filling against closed tricuspid valve. That is very important. Okay, that is not important MCQs regarding this, but the next very important is the Y descent. It will occur when the right atrium is emptying the blood into the right ventricle. Okay, so Y descent is prominent and sometimes it can be the absent. So it is absent and prominent. Absent and prominent. Absents occur in which diseases? Cardiac tamponade. Absent in cardiac tamponade. Okay. And prominent in which disease? It is prominent in constrictive pericarditis. Constrictive pericarditis. Okay. This is very important MCQs. Remember this.